Welcome Friday Focus, January 13th, Friday the 13th, so good luck today. We're going to talk about some things that we're maybe holding back on our patients. And I've been going around the offices and we're talking a lot about the big year 2017. We want to really have an opportunity to give our patients the advantage of knowing things that we can offer them that can have potential to have an impact on their life. I was talking with the dermatology team about really skincare, and what they're doing is taking off cancers, kind of cancer specialists, but we really should be cancer prevention specialists. We're going to roll out something of that nature in this next, in this month probably, to reduce our patients' chance of getting skin cancer. I talked to you about the book's coming out. It's coming out Friday, probably came out today. The book called Testosterone Strong Enough for a Man but Made for a Woman. And it's about the way we're doing hormone replacement now. We used to use estrogen. It turns out we just picked the wrong hormone. And if we put women on testosterone replacement, not only do they have resolution of symptoms of menopause and no adverse drug events, but they have a 72% reduction in the rate of breast cancer, 72%. And we're like negligent to our patients. We're not telling them, hey, this is an option for you. So when the books come out, you might want to read that so you get more comfortable with it. I'm going to talk about another thing now. We don't deal with a lot of men, but we kind of do. We have I ran into a guy this morning at my gym that had some cancer lesion moved from his leg. Our vein patients are about 30 or 40% men, and our derm patients are probably going to be about 40 or 50% men. We even have some men getting cosmetic procedures now. The hair department, their department's about half men. What about men's health? Are we neglecting it? Well, we offer hormone replacement for men. Have been for about 12 years, since 2004. And the data's coming out stronger and stronger that this is really important as men age, that if they do have low testosterone, that they be evaluated and treated. I'm just going to tell you kind of a little story. So testosterone replacement started about 30 or 40 years ago when we noticed that some boys were born without their fully developed chromosome. They'd have instead of XY, which is XX is a female, then XY is a male, and some men were born with XXY. They had an extra female chromosome, and their testicles wouldn't develop. They wouldn't have much facial hair. They'd be kind of small, and they died very young. They have a lot of heart disease and more cancers, and it was this extra female chromosome was keeping them from making testosterone. And there's different names for it, like Klinefelters and others. But they think fact of the matter is their genetics were messed up. And there was also boys that would have like mumps, which would affect their testicles, and they wouldn't form, and they would get low testosterone, and they would die younger. And there were people that had brain tumors of the pituitary gland, which is in your brain. It's a gland that tells your testicles to make, or a man's testicles to make testosterone. And these men would be sicker and not develop properly, and they would have more premature deaths. And that led to treating them with testosterone replacement, and they got an FDA approval. One of the few things that testosterone is FDA approved for is women with breast cancer and men with absence of ability to make testosterone from it because their testicles are damaged, their brain's damaged, or they have an extra female chromosome. So back about 30 years ago, doctors started treating men with what we call age-related hypogonadism. So it's where your testosterone production might fall down similar to a woman getting menopause. Some people call it andropause or late onset hypogonadism or just low T, low testosterone. Some of you might remember the commercials that said, do you have low T? And it was called, this was the campaign, it's called Low T. And the company, Abbott Labs, they made this commercial to make public awareness because studies were showing that men with low testosterone, regardless of the cause, if they were treated with testosterone replacement, they would not only live healthier and have improvement of some of their symptoms like fatigue, decreased libido, decreased energy, but they'd also have less heart attacks. Some people thought perhaps testosterone replacement could cause prostate cancer. Totally false, it does not. In fact, there's a slightly lower rate of prostate cancer. And testosterone replacement became fairly widespread. In fact, the use of testosterone between 2000 and 2010 went up 400%. So men were become aware of the testosterone deficiency because of this low T commercial. Say, well, if you get a little weight, putting on weight and some diabetes, you might have low testosterone. Men were going in and getting checked. The doctor would do a blood test, symptoms correlate, put them on testosterone replacement, they'd feel better. Well, in 2013, November, an article was published in the Journal of American Medical Association. It was done out of a VA, and they found that men on long-term testosterone replacement had an increased risk of heart attacks in the first 6 months versus not taking anything. And the FDA immediately responded. 2 days later, they started reinvestigating testosterone. They looked at the studies, and on January 31st, 2014, they made the manufacturers stop doing the low T commercial. They made testosterone Reed made new rules for testosterone where it can only be used for men that have no testicles, have brain damage, have extra X chromosome. And it can only be used in those settings and nothing else. And it should not be used for low testosterone otherwise. Well, it turns out the study done in November in the Journal of the American Medical Association was false. They screwed up the data. There was actually a 50% reduction in heart attacks. 50% reduction. And the FDA went by that one study, even though it was 120 studies showing less all-cause mortality, less likely to die, and less heart attacks. They found one study that said there was increased heart attacks. It was flawed, it was wrong, it was retracted, but they based their new rules on it, and they've kept it to this day. There's 29 medical societies that have asked the FDA and the JAMA to specifically retract that so that they would stop this nonsense of you can't use testosterone for men anymore, according to the FDA. But they're sticking with it because once the FDA decides something, they kind of are arrogant and they stick with it. And it's one of their biggest blunders. Just to put it in perspective, you might think the FDA is a government agency, they can do no wrong. Well, the FDA went after food manufacturers in the 70s because they put the salt content on food. They would label it on the box. And the FDA said, you can't do that, that implies that it's healthy to have low salt, take it off and we're suing you. And then they started putting saturated fat and fiber contents on the box. The nutrition labels that you read, the FDA sued food manufacturers for doing that, saying that that was something that was misleading consumers and they didn't want the consumers to make health decisions. The FDA did not want consumers to make their own decisions, so they made the manufacturers take the labeling off. Well, the Congress in both cases passed laws that allowed food manufacturers to put their nutritional information on the box so the FDA would stop suing them, okay? But they didn't go after them for this, so it's still there. So let's talk about how things have gone since there. Well, the FDA, in spite of their complete blunder, doctors have basically ignored them. The FDA does not regulate the practice of medicine at all. They regulate drug manufacturers. So they can tell a drug manufacturer not to advertise it for low T. But they can't tell me, or you as a patient, as a man, let's say, which you can and cannot do. Okay, they don't have any jurisdiction whatsoever. So the FDA can say that, and they can, and even though they've acknowledged that the data that they based their recommendations on, or their rules on, is flawed. They admitted, yes, there is no evidence. Okay, in 2016, November, 3 years after the first study, they came back out and said, yes, we acknowledge that there is no evidence that testosterone increases a man's chance of heart attack or stroke. Yet, since we cannot prove it doesn't, we're still going to leave that. They must label it that it could cause it, because it could, right? That's what they're saying. It's nonsense. So there was a study done at a VA, another VA study, Kansas City, Kansas, and they looked at 83,000 men in the VA, an average of 66 years old. 83,000 men, and they followed them for 6 years. So these were older men, some of them were going to die, obviously, and they followed them for 6 years, and they all had low T. So they had low T. Not because they were missing their testicles, they just had low T. Most men do when they're 66. Group 1 was treated. Group 2 was not treated. Okay? And they followed them for 6 years. These men that were not treated with low testosterone because their doctors followed the FDA rules had twice the death rate, double. They had twice the heart attacks and twice the strokes. The FDA not only screwed up, but they had a huge negative impact on healthcare, because what was happening is the use of testosterone was starting to double every year in older men. When the FDA made these rules, they spooked doctors that don't understand, they don't have to listen to the FDA. They spooked manufacturers and told them they could no longer do a low T commercial, okay? They're not allowed to let consumers know and educate them that if they have low testosterone, their death rate will go in half if they're treated. Long-term studies looking at men on testosterone regarding weight. There was a study with 411 men, BMI over 30. BMI over 30, this is done in Germany. 30 over 30 is kind of like the patient we do the balloons on, their bare balloons, they're heavy. And they followed them for 8 years, 8 years. In the 8 years, they lost an average of 48 pounds. In the BMI over 30, the ones over 40 lost an average of 78 pounds. And only 3 men out of 411 did not lose weight in 8 years. Now let's look at reality. When these men were left untreated, how many of them would not have lost weight in 8 years? It'd been all of them. They wouldn't have lost weight, and that's why they're coming in for the balloon. Are we offering that to our patients? Numerous studies have shown that testosterone is kind of protective against prostate cancer. I don't really want to say that because there's not definitive evidence long-term that reduces cancer, prostate cancer, but it looks to. It certainly does not increase it, and that's a common misconception. I'm not sure why doctors think that, but for some reason they made it up and think it. It reduces a man's chance of heart attack and stroke if he has low testosterone. It reduces his chance of dying prematurely by 50%. Testosterone replacement is something that we offer here. It's very simple. We do a blood test. The blood tests are kind of like more of a guide. What happens is that the determination for low testosterone is supposed to be made clinically on symptoms. We still check a level because it kind of correlate them a little bit, but there's not an absolute level which predicts who would benefit from testosterone replacement therapy. And we can treat these guys, okay? In 2016, July, the International Consensus Expert Panel came out with guidelines for doctors. It was published in the Mayo Clinic Proceedings. It was something that all physicians were supposed to read, and a lot of them just ignored it. And it said, there is absolutely no basis to the FDA's rule that testosterone replacement only used in men that are missing their testicles or had a brain injury or had an extra X chromosome. And they also said that the cost of not treating low testosterone in the US alone in the next 20 years will be over $500 billion from additional diabetes, heart disease, and death. Long-term studies have shown that over a period of 6 years, men that have type 2 diabetes no longer have it when their testosterone replaced it because they all have low testosterone. Okay, all these men with type 2 diabetes and a beer belly have got low testosterone. When they're treated, at about 8 years, they no longer have it. Think about the implication we have on our patients. Are we talking to them about it? We had the handout that we give people so that they can get the blood work done. Are we telling every man that's, say over a certain age or is me a little heavy, hey, let's check your testosterone level. This is an important public health thing. It's something we can offer our patients. So let's stop holding back on our patients. In the big year, one of the things we're going to do, we're going to impact our community more than we ever have before. Okay? And if that means cutting down breast cancer, cutting down heart attacks in men, cutting down deaths in men, decreasing obesity, reducing skin cancer by checking for it, and giving them things they use to prevent it. That's what we're going to do. That's how we're going to grow our business. We grow our businesses through our customers. Through our customers allows us to have more influence and more impact on more people. So thank you very much.